Anal sex has been the rave in recent times, and studies show that consensual anal penetrative intercourse has become more prevalent among all populations and not only limited to gay, bisexual, or men who have sex with men. Women in relationships with men have also taken to anal sex as a regular form of sexual play. I was asked if anal sex is a cause for fecal incontinence, which is a very important question. So let's break down the potential relationship between anal sex and fecal incontinence. Hi, I am Dr. Tanji, the sex doctor, board certified clinical sexologist, and on a mission to empower people to exercise their autonomy and practice ethical, healthy, and satisfying sex without any judgment or shame. Welcome! If you are new to my channel, please subscribe. YouTube does not like my content and hides it from view, but your likes, shares, comments, and definitely your subscriptions help this channel grow and send the clear message that we all deserve and need a safe space for sexual learning. So take 1 second to find the subscribe button and click on it now. Thanks. It means a lot to me. Okay, so back to anal sex and fecal incontinence. If you are considering adding anal pleasure to your sexual repertoire, or you are a practicing backdoor operator, here is what you need to know to ensure anal health while practicing anal sex. First, what is fecal incontinence? Fecal incontinence is defined as the loss of liquid, solid, or mucus stool occurring at least monthly. In other words, it's the inability to retain feces or stool until reaching a toilet. Symptoms of fecal incontinence can range from mild leakage of stool or gas to complete loss of bowel control, which leads to the person soiling their underwear, not being able to control their gas, and not being able to hold their poop inside until reaching a bathroom. Second, is it true that anal sex causes fecal incontinence? Let me interrupt to invite you to talk to me live. Follow the link in the description section of this video to book your time with me so you can ask me your sex questions directly. I hope to see you soon. Looking at the literature, the studies are limited in size and scope. However, let me share some studies with you to shed some light. A study published in 2024 in the Archives of Sexual Behavior reviewed 68 references to other studies that have been conducted in the matter. The results showed that anal penetrative intercourse is in fact a risk factor for anodyspareunia. And what is anodyspareunia? Anodyspareunia is feeling pain or discomfort during receptive anal intercourse. Anodyspareunia is a form of sexual pain disorder and can affect both women and men. The studies in reference also found that the receptive anal sex is also a risk factor for fecal incontinence in both men and women. Another study published in the American Journal of Gastroenterology in 2017 analyzed data from 6,150 adults 20 years or older from the 2009 to 2010 cycle of the National Health and Nutritional Examination surveys. Data showed that anal intercourse is a predictor of fecal incontinence among men and women. Something very important to note is that according to a study published in the European Journal of Gastroenterology and Hepatology, showed that unwanted anal sex reception is more highly correlated to fecal incontinence. The study was conducted among 7 victims of sexual abuse that included unwanted anal penetration and found that all had permanent structural anal sphincter damage, which led to fecal incontinence among the victims. So what is the big lesson here? Based on these studies, should you engage in anal sex? Can you do anything to prevent fecal incontinence and still practice anal sex? First, the big lesson. The risk of fecal incontinence due to anal intercourse may increase with emotional discomfort and tension, and overactive pelvic floor structure, lack of proper lubrication, the frequency of anal penetrative intercourse, and hard anal penetration practices. If anal sex is done forcefully or without adequate lubrication, it may lead to trauma or stretching of the anal sphincters, which are the muscles that control the passage of stool, which can increase the risk of incontinence over time, particularly if there are repeated injuries. Regular, rough, or high impact anal sex could potentially strain the anal muscles, leading to weakened sphincter control, although this typically requires long-term, frequent exposure. Individuals with conditions that already affect the pelvic floor muscles, like childbirth-related injuries, surgeries, or neurological conditions, may be more prone to fecal incontinence to begin with and might experience exacerbated symptoms from anal sex. Finally, not using adequate lubrication or engaging in activities too quickly without proper communication or gradual adjustment can increase the risk of muscle damage, discomfort, pain, and injury, leading to possible long-term issues like fecal incontinence. Should you engage in anal sex, especially receiving it? Well, I always say that your body belongs to you, so the decision to engage in anal intercourse is totally your choice. Based on the evidence, if you decide to engage, follow these steps to mitigate your risks. Consent is crucial for anal sex. Both giver and receiver should talk about this practice, negotiate boundaries, and stop altogether if there's any doubt, discomfort, or pain. Use plenty of lubrication. Lubrication can help prevent trauma to the anal area and reduce friction, making the experience more comfortable and lowering the risk of injury. Take it slow and communicate. Gradually adjusting to the experience and having open communication between partners can help ensure comfort and prevent excessive strain. Strengthen the pelvic floor muscles. Pelvic floor exercises like Kegels can help improve muscle tone and reduce the risk of incontinence. Consult with a specialist. If there are concerns about incontinence or pelvic floor health, or if you are a regular receptive anal sex participant, consult with a pelvic floor specialist that can provide personalized advice and treatment. While occasional anal sex itself does not directly cause fecal incontinence, long-term or improper practice without precautionary measures could contribute to muscle weakening or injury, leading to fecal incontinence. So take it slow. Always communicate openly and honestly throughout, and reassess your sexual practices based on your experience. If you have any experiences to share, leave your comments below. We all want to know. As always, I wish you healthy, safe, and pleasurable sex of whatever kind you practice. This is Dr. Tanji, the Sex Doctor, and I'll see you next time.